what happens is what's called bone resorption. Your bone has a tendency to wear away. This happens most dramatically in your lower jawbone. With upper teeth, as you lose your teeth, if you decide to do something removable like a denture, you have the whole roof of your mouth to hold a denture or a partial denture in. On your lower, you don't. You have a horseshoe arch. And as your bone shrinks, it doesn't shrink to the inside, it actually shrinks to the outside. But on your upper bone, when you lose teeth, your bone shrinks to the inside. So what do you do when now your lower jawbone is out here, but your upper jawbone is in here? How do you function like that? So the loss of teeth is a dramatic consequence for your ability to chew and function. The picture on the right is one of the options that we have today for people who have lost all their teeth or are going to lose all of their teeth. Traditionally, many years ago, you got a denture. And now what happens is they're loose, they don't fit, you're not happy with them, your muscles have tried to adapt, your tongue has tried to adapt to holding them in, you've learned a new way to chew. It doesn't have to be that way anymore, you don't have to suffer through that. Nowadays, we can place dental implants, which we'll show in a minute, which are little titanium screws into the bone. And these little blue buttons go inside of your denture, and they snap on just like the buttons of a shirt. So you don't have to worry about that denture moving. Okay, so again, we talked a little bit about sleep apnea. This picture here is a sleep apnea CPAP device. Looks a little bit like an oxygen mask. Some people sleep in that every single night, and you don't have to. You can sleep in something, and I have an example up here that looks like a mouth guard. Does the same thing. Takes your lower jaw, moves it forward, opens up your airway. Also, if you lost a tooth, a lot of times your dentist would say, if you've seen a dentist recently, you have an option of a bridge or an implant. Which would you like to do? There's pros and cons to both. It depends on the situation. They're both excellent treatment options. Basically, a bridge are the crowns that are soldered together and cemented in your mouth. An implant is a titanium screw that goes into a bone with the crown cemented on it. But if you don't have teeth that are next to the area where you're missing, we can even do implants now on someone who has no teeth, and instead of having a denture that snaps on like buttons, we can actually screw into those implants and you don't even have to take your teeth out at night anymore. This is an example of a gentleman who the rest of his teeth look great. He had a car accident many years ago and lost his upper front teeth and wanted to get out of his denture. So you can see that he lost quite a bit of bone on the top, but that's okay. We were able to compensate for that and create porcelain ceramics that replaced his front teeth. Everything else in his mouth was fine.